you will need an alcohol-based hand rub formulation or soap, water, and drying agents such as disposable paper or cloth towels. Use alcohol-based hand rubs with proven antimicrobial efficacy. These usually contain 60 to 80% ethanol, isopropanol, or N-propanol, or a combination of these products. These hand rubs are supplemented with emollients to protect the skin. They are available as liquid solutions or gels, sprays, or foams. Containers with these products should be easily available, within arm's reach, either at the point of care, that is, within 3 feet of the most likely use, or should be carried in small bottles by healthcare providers for their own personal use. We will first review some of the basic principles of cross-transmission of microbial pathogens. The skin and mucous membranes of every human being are colonized by various microbial species. When hospitalized, patients gradually shed these microorganisms onto inanimate objects in their immediate surroundings, for example, onto bed linens, gowns, and bedside furniture. Hospitals contain a multitude of environments. Some of these, dubbed patient zones, consist of a patient and his or her immediate surroundings. As a result of contamination by both healthcare workers and patients, other areas of the healthcare setting, such as corridors and public areas, are also colonized with microorganisms, though to a lesser extent than patient rooms. Cross-transmission of potential pathogens from one environment to another occurs through healthcare workers' hands. Hand hygiene greatly reduces the risk of cross-transmission by this route. Healthcare workers must perform hand hygiene immediately before touching a patient or when entering a patient zone. This will prevent cross-transmission of microbes from one patient to another. The correct moment to perform hand hygiene before touching a patient is critical. Hand hygiene should be performed close to the site of care in order to avoid recontamination should your hands inadvertently come into contact with an object distant from the patient, the doorknob, for example. Perform hand hygiene between the last hand to surface contact with an object located outside the patient zone and the first within the patient zone. You should also perform hand hygiene just after touching a patient and before touching any object located outside the patient zone. This will limit the risk of germ dissemination to the healthcare environment. Even if you did not touch the patient, perform hand hygiene after touching objects located in the vicinity of the patient. For example, perform hand hygiene after touching a monitor, bedside table, or bed rail, since these may also be contaminated by the patient's microbial flora. There are body regions that must be kept as free of microorganisms as possible. These include zones of impaired host defense, such as breaks in skin and mucous membranes, surgical wounds, for example, or sites of invasive device insertion, such as vascular or urinary catheters and endotracheal tubes. Microorganisms that colonize the healthcare worker's hands, the patient's skin, or immediate surroundings must not be introduced into these zones of lowered immune protection. There are 2 recognized techniques for performing hand hygiene: hand rubbing with an alcohol-based formulation and hand washing with soap and water. To perform hand rubbing, apply a palmful of hand rub formulation to a cupped hand and rub your hands together to cover all surfaces. Then rub your hands again, palm to palm. To reach the dorsal interdigital area of your hand, rub the fingers of one hand over the dorsum of the other and interlace your fingers. Repeat the procedure on the palmar side of your hands to reach the palmar interdigital area. To cleanse the dorsal aspect of the distal phalanges, rub the back of your fingers across the palm of the other hand with fingers interlocked. To cleanse the base of the thumb, clasp it in the palm of your other hand and rotate your thumb. Finally, decontaminate the tip of your fingers and the subungual region by rotating them on the palm of the other hand. Once dry, your hands are safe and you are ready to work. The entire procedure should take you 20 to 30 seconds. To perform hand hygiene with soap and water, wet your hands with water and apply the amount of soap necessary to cover all surfaces. Avoid using hot water as it may increase the risk of dermatitis. Rub your hands vigorously to cover all surfaces. Then complete the hand washing procedure by following the steps previously described for the hand rubbing procedure. Once your hands have been thoroughly decontaminated, rinse them with water. Wearing jewelry such as rings increases the bacterial load of the skin. Do not wear rings and bracelets during patient care. If you have a wedding ring, a simple alternative is to wear it on a chain around your neck. In some settings, wedding rings may be tolerated. Review and comply with the policy in place at your healthcare facility. Long fingernails have been associated with infection outbreaks of resistant pathogens in healthcare settings. As a result, you must keep your fingernails short, less than 0.2 inches or half a centimeter in length, and refrain from wearing artificial nails. Use of these products in healthcare settings has been associated with outbreaks of infection with resistant pathogens. There are some common problems associated with hand hygiene. Irritation dermatitis can occur after repeated use of hand hygiene products. Common symptoms include dryness, itching, and sometimes cracking and bleeding. In rare cases, allergic dermatitis can occur. Damaged skin is more difficult to disinfect and may be more susceptible to skin colonization, leading to transmission. To prevent skin irritation, use skincare products frequently during work shifts. These products should be freely and widely available in your healthcare facility. You should also use alcohol-based hand rubs. Avoid the use of hot water when washing hands. Refrain from using gloves unless specifically needed. And dry your hands completely before donning gloves.